So to review, Hashimoto's is one type of hypothyroidism. Remember, hypothyroidism is the umbrella term. It just means low thyroid. We don't know why. And in the case of Hashimoto's, our immune system is attacking our thyroid, which then leads to decreased output. The components of the immune system that are damaging our thyroid are antibodies, which again, they're little proteins that our immune system makes, and they stick to things. Normally they stick to bad guys, but in this case, they stick to things like TPO and thyroglobulin, and these things should be assessed on labs and can be easily done as part of an expanded thyroid panel. Now, if you have a family history of autoimmunity, chronic widespread symptoms, even with negative testing, it still may warrant a clinical trial of immune support as long as other aspects of your health are being addressed holistically at the same time. Now, the last point I'd like to make here is that sometimes we can get so caught up in the diagnosis and reading different types of blogs and things on the internet where it's said, yep, I've got that, yep, I've got that, yep, I've got that. I know I have thyroid issues, I just don't know why. It's important to also understand that a lot of the thyroid symptoms that are out there are vague. They don't necessarily have one reason for why that could be caused. So someone with fatigue, they could have low thyroid function, or they could have an anemia. You don't know what it is until you start testing, and it's also possible that those things could be going on at the same time, both contributing to the fatigue. So keep in mind that even though you think you have thyroid symptoms, there is the possibility that it could be caused by failures or dysfunction elsewhere because these things tend to overlap. So our third section tonight, and something that I really wanted to make sure we spent a little bit of time on, is strategies. So when it comes to strategies, there's a couple things that are really important that we just tuck into our brain. And the big one is that there are pros and cons for any type of intervention. And the thing that I always think about, because it's the world that I live in more commonly, is a lot of our dietary and supplemental interventions. So when people are researching and trying things at home, and they utilize some sort of, we'll just say some sort of supplement, and they have a negative reaction to it, understand that that is a possibility. Just because something is natural doesn't mean that it is necessarily good for you, or it is being used at the right time, or it's being used in the right amount. And so with these types of changes that you're looking at making, make sure you do your due diligence and don't just say, well, I know that this is healthy because of da-da-da-da-da. Understand that there are positives, there are negatives, and be aware of those things before you jump into any sort of support or change that you're trying to make. The other thing that's really important, and this kind of ties into our first point here, is when we have a lack of immune tolerance, there is a possibility of reacting to any kind of supplement or any kind of medication at any time. Your body's ability when you have Hashimoto's or any other autoimmune condition to discern what is friend and foe is compromised. And therefore, it is going to be more sensitive to things in its environment. And your ability to identify what those things are, whether they be triggers in your day-to-day environment or new things that you introduce through your own research or working with a doctor, any of these things can disrupt the way your body works, and it shouldn't be something that discourages you. And I understand that it can be discouraging. The thing is with this stuff is it can be very complex. And so we just need to understand that there's no magic pill, and if we address these things holistically and in concert with one another, then we have the best chance at getting better. But because we can react to any sort of supplement or medication, if we do have that response, that one thing is not going to hinge our entire process. It's not going to either make it or break it, and those things can be worked around. So I commonly see this with people potentially taking Synthroid and then they're switched to levothyroxine, or they're taking levothyroxine and they switch to Armour. And of course, we don't do this type of medication management in my clinic, but these are the things that are going on either with their naturopath or their endocrinologist or their primary doctor. And I'll hear things like, well, I felt really good on this, but I was still having symptoms, so I switched to this, and things went awry for me. Well, again, be aware that not one thing is going to work for everyone, and it's most often a good way to go after things by working with the stuff that works with you. So whether that's medication or whether that's with supplementation, make sure you have a conversation with your doctor and you're working together as a team to find the stuff that fits you. And if it doesn't resolve everything, then you can always look for other options that are tied into what might be causing those symptoms. So with that framework set, where do we start? And that's always a big thing for people because the amount of information can be overwhelming sometimes. And I think the very best place that we can start is through dietary changes and strategies. And why do I think that? Well, one, most people have a huge amount of improvement that they can make in their diet. And so that gives us the possibility for a lot of growth. The other thing is that diet is something that we can change right now. And it's something that affects us on a daily basis, multiple times throughout the day. So this is something that is hugely impactful for that reason on our overall health, and it has a direct correlation to the way our thyroid works in a number of different ways. So what do I recommend for dietary strategies to help people feel better? Well, the first thing I can say is adopt a whole foods diet. And what I mean by that is avoid things that are processed. Things like processed fats, processed sugars, foods that are being made by restaurants or fast food restaurants, things that come in microwavable boxes. All of that stuff is not natural to the human digestive tract. And the better job that we can do at reducing and eliminating those things, the more leverage we will have for supporting our health and supporting our thyroid function. Now, if we were to take that one step further, I am a big advocate, and I don't mean to put labels on things because I think that can very much steer us in the wrong direction, but I advocate for a paleo style diet. And that fits in as sort of one of the different strategies that would go under a whole foods approach. Now, oftentimes people will get things a little confused and think, oh, paleo, that means a whole lot of meat, right? Well, no, that's not what I mean, and I think that that is a common misconception. What I mean by paleo is things that are natural and like I said, come in their whole food form. Those are things that we should eat. And things that are chemically processed, those are things that we should typically avoid. So no, I'm not advocating that we live like cave people, but I am advocating that we should have less refinement and sort of this scientific intervention that can occur with our food. And if we just go back to, I've used this example before, saying an apple is an apple, there's no nutritional label on it, there's no list of different ingredients, that is something that can be healthy and beneficial towards us rather than something like a cookie, which can have a whole number of ingredients. And if it's something that's made at a store or a plant, it's going to have a number of things that could be detrimental to our health. So the overarching principle is whole foods. And if we take it one step further to help people out with thyroid conditions, paleo, where we avoid some of those refined grains, processed sugars, beans and legumes for those people who are sensitive to it, and focus on healthy fruits and vegetables, healthy, moderate protein intake, and healthy fat intake, that can go a long ways in improving our health. Now, for some people, this will not achieve the changes that we need, and that's okay. And for those people, it's important that we take it one step further. And what I will typically recommend in those situations is an autoimmune paleo plan. And again, these are things that you guys can look up online. They're well documented and easy for anyone to access. So in regards to an autoimmune paleo, what is going on in this approach is we're still keeping that whole food mentality, but we're removing some of the more common dietary triggers that can be problematic for people with autoimmune conditions. So remember, we want to improve that tolerance between friend and foe for our immune system, and if there's something that's continually triggering it, it can cause disruption in that. So with autoimmune paleo, again, it's one step further past paleo, where now we're saying things like eggs are a common trigger, and we want to make sure that that is removed. Things like dairy can be a common trigger. We want to make sure that those are removed. Soy and corn are removed. Non-wheat grains like quinoa, buckwheat, millet, etc., those are removed. And we're also removing other things that can affect that, things like alcohol, caffeine, etc., to get, yes, a more refined diet, but again, at its essence, it's focusing on the same things that the paleo diet is, which is those whole fruits, vegetables, proteins, fats. We've just taken it a little bit further to make sure that we are addressing potentially some foods that are not going to work well with our system. Now, finally, some people may need additional help beyond the autoimmune paleo, and that's where our specialty diets come into play. Things like low FODMAP diet, specific carbohydrate diet, different types of modified fasting. All of these can be valuable in supporting not only our digestion, but also our thyroid health overall, and may be required if we're not seeing changes with any of the previous diets. Now, the reason why I have it listed out as I did and why I described it to you as I did is while you're looking to change up the way you're eating and support yourself in a more holistic and healthy way, I think it's a valuable learning experience to start at the top and progress through these different types of dietary options, because no one diet is going to be perfect for everyone, and we learn as we go through each one different tenets which can be beneficial to us. So it's very common for my patients, as we improve in their health and as they move down the line towards a more normal life, where they may run a cross between a couple of these different things, and they have different indulgences that they like, that they know when are consumed in small amounts, work with their health, don't cause a regression of their symptoms, and allow them to continue to live the life that they want to live. Now, the diet that we choose and the diet that we implement can be key. And the reason is there is no supplement or medication that can overcome a bad diet. So if we have something from our diet that is driving this autoimmune dysfunction, there's no way that we can, as I said, overcome that with some sort of patch or band-aid. It'd sort of be like if you were hammering your thumb every day, 3 times a day, and afterwards you're wondering why it hurt because you keep putting new band-aids on. Well, it's because there's some sort of trigger in your diet that is contributing to this dysfunction. And you kind of got to frame it that way to understand the sort of changes that can go on. Now, as we look a little bit more specifically at some of the things within these diets that can be problematic for people specifically with Hashimoto's, wheat and dairy products are some of the biggest hitters that we see clinically when it comes to immune reactivity. And it's very common for me to hear people say, oh, well, I removed gluten, but I didn't get any better. And that's where adding dairy to that approach can be big. And you can see how we would go through this same progression with anyone of saying, okay, well, if we didn't see the changes that we need, how do we add in something else, or how do we change something else? And if we don't see the changes with dairy, then we may progress into other areas. And that's at the next bullet point here, which is, you have to use caution when you have Hashimoto's with highly processed foods, especially things like corn, rice, non-wheat grains, and soy. Now, just because a food is quote unquote healthy does not mean it is healthy for you or it works with your system. So an egg, I think an egg is one of those perfect foods, but not if your immune system doesn't tolerate it well and it causes an inflammatory response. Yes, the proteins, fats, and nutritional aspects of it are good, but that doesn't change the way that your body is responding to it. Other things that could be components with that and can be limited or eliminated in things like an autoimmune paleo approach will be things like nuts and nightshades, which includes tomatoes, white potatoes, eggplant, bell peppers, spicy peppers, etc. Now, I'd like to be really, really hammer down on this second to last point here, which is don't overanalyze your choices. Make a decision about your health history, your food history, and what has worked well for you previously. Add on the things that you think may be valuable, but don't become paralyzed by, should I eat that? Should I eat that? Or any sort of fear response thinking that, oh, if I eat that, that'll be the end of all the progress that I've made. Yes, diet can be huge. Yes, we see many positive changes from getting people on the right dietary plan. But small indiscretions in your diet will not derail the large bulk of work that you do. And there's probably not so much nuance to this sort of stuff that you are going to be missing a minute detail which is causing you to lack improvement. And my example for this is sometimes I have people say to me like, I'm doing autoimmune paleo and that's worked really well, but I'm still not there yet. And I'm thinking, maybe I have to make sure everything's organic, or I have to make sure that, the meat I'm eating is all grass-fed. Are those great things and important things to work towards and shoot for? Absolutely. I think that the more we can incorporate that stuff, the better. However, if we're still having symptoms, it's most likely not that minute little detail which is causing the hang-up for the rest of your symptoms. And so my point here is that diet is powerful. Yes, it can improve our symptoms, but don't become paralyzed by information and realize that diet is not everything, and we may have to incorporate other types of approaches to be able to get you to that next level. Lastly, I always like to include the rule of thumb, and this is for everyone. So the rule of thumb is literally the rule of thumb. If you're out shopping and you cannot cover the ingredients on an item that you're thinking of buying with your thumb, then it's probably something that you shouldn't be eating. And you guys all know what I'm talking about. If you pick up a salad dressing which has extra virgin olive oil and oregano and some garlic and whatever other spices you like to throw in there, that's something that sounds healthy and appropriate, and certainly something that you could incorporate into your diet. Now, if we pick up some sort of ranch off the shelf and the first ingredient is corn syrup and the second ingredient is high fructose corn syrup and the third ingredient is sugar, and then you have a whole bunch of preservatives and different binders and emulsifiers in there, that's something that your thumb isn't going to be able to cover up, and probably something that you shouldn't be eating, whether you have Hashimoto's or not. So as I said, diet is huge, but it isn't the be-all, end-all. And if we found a diet that's working for us and we're starting to get really down that rabbit hole of okay, well, what's the tweak that I need to make to get me to the next stage of my health, that may not be what we need to look at. Instead, it can be really valuable to look at other areas of our health. And two of the biggest areas and different places that we should intervene to support thyroid function is, in regards to Hashimoto's, our gut and digestive system and supporting our immune system. And the reason being is because these things have such profound effects on our immune system tolerance and the way it interacts with the rest of our body. So if we found that diet that's working well and we're looking for the next step to take, some of the things that we can do is look at supporting our gut. And as I've stated before, it's important to remember that we can have gut dysfunction without overt symptoms, meaning a lot of times when people think about their digestive system being off, they think about bloating or gas or indigestion or cramping or diarrhea or constipation, all the things that are associated with that. But as we've said before, fatigue can be a problem that's associated with our gut. Depression and anxiety have a strong connection with our gut. Autoimmune system dysfunction has a strong association with our gut. Skin disorders. So even though we might not be having our classical gut symptoms, we could still have gastrointestinal dysfunction. And the reason is because this is a huge area for where we interact with our environment. So some of the things that we do employ, depending on the situation for people, is things like considering hydrochloric acid or HCl support and or other types of digestive enzymes. And so HCl is something that's primarily made from our stomach and helps us to sort of initiate the digestive process. And digestive enzymes, sort of the proteases and different carbohydrate enzymes, those are going to be primarily produced by our pancreas. And using either one or the other or in combination can be really beneficial for people if they're dealing with things like reflux, or they see food in their stool because they're not breaking it down completely, or they start to get symptoms within 30 minutes after eating a meal. So we want to make sure that in terms of breaking down food, we do a good job of that, and we may need support from different types of digestive enzymes. Another place that can be really, really powerful for supporting our gut is through probiotic therapy. And probiotics are great because they show low risk of negative side effects and have many positive impacts on, as we've said, our gut and thyroid function. So there's different categories of probiotics, and while most of the research is done on that first line there, the Lactobacillus and Bifidobacterium blend, the research does not necessarily favor that over other types of probiotic interventions. When we employ probiotics in the clinic, what we will do is we will typically take people through a progression where we start with a Lactobacillus Bifidobacterium blend. And again, there's no magic supplement with this stuff, but we like to get up into the 50 to 100 billion culture forming units 2 times a day, just to give you guys some context for that, with those blends. Now, some people react to these, and there's evidence that shows they could increase a histamine immune response. Some people will get bloating and increased urgency or diarrhea. And if that's the case, that's okay. It just tells us something about how your gut is working. Now, for some people, we just may need to reduce the dose. And for other people, we may need to look at other categories of probiotics. Remember, there's no magic bullet, and all of these probiotics have been shown to be beneficial, even though the Lactobacillus and Bifidobacterium have been a little bit more researched than the other ones. And the reason for this is not only because of the positive microbial effect that it can have on our gut, which is very supportive, but also because it has antimicrobial effects on things that we don't necessarily want being part of our digestive tract. And the reason why this can be so powerful is because our thyroid, when it becomes low, one of those places that we really need thyroid hormone is our gut. And when we have slow down our changes in our gut, that doesn't always mean things like constipation, but it can mean changes in the cultures that live in our gut leading to a perpetuation of inflammation, which can be managed with these probiotics. The other one that we like to use is a yeast culture called Saccharomyces boulardii. And this has been shown to be particularly effective in people who are experiencing things like chronic diarrhea, but also has a lot of the same positive impacts that the Lactobacillus and Bifidobacterium has in regards to promoting good culture and reducing negative cultures. And typically these things will be dosed around the 5 billion to 10 billion culture forming units per day. Lastly, for some people, the probiotic therapy may not be enough, and so it can be very valuable to use an herbal antimicrobial blend to help reduce and normalize dysbiosis in the gut. So the reason why I use the term blend here is because oftentimes people say, oh, well, I heard oregano can be good for this stuff, or I heard garlic can be good for it. And that's true, but when we run out and we buy, a specific garlic extract or oregano extract, typically, due to the wide diversity of microbes that live in our gut, those may address 1 or 2, but not 3 and 4. And so to help normalize your gut in the best way, we want to include a antimicrobial blend that includes things like oregano, berberine, garlic, cat's claw, wormwood, etc., etc. There's many of these natural remedies that have been used in the past, and all of these can be valuable for helping to improve our gut function. Now, just like with the probiotics, it is important to realize that some people do not react well to these things, and having a blend of herbs can be very tough on our stomach. Additionally, some of these herbs can be immune drivers, and when we have this sort of immune system dysfunction associated with Hashimoto's, it may stimulate the immune system in a manner that can create more inflammation rather than less. So again, remember, there isn't a one-size-fits-all for this stuff, and just because one thing doesn't work doesn't mean all is lost. It just means we need to go another route. So to drive home this point, here's some really awesome research which shows that intestinal dysbiosis can be improved and help support autoimmune disease through probiotic application. And so what I have highlighted for you guys there is that there's a number of studies where changes in our gut microbiome can contribute to things like autoimmune diseases. And in this specific study, they reference things like type 1 diabetes, which is an autoimmune disease destroying the beta cells in your pancreas, multiple sclerosis, which is an autoimmune condition where your immune system is attacking the nervous tissue in your brain, and rheumatoid arthritis, as well as systemic lupus. So all of those are just different types of autoimmune conditions. And the reason that they are named for different things is because they affect different areas in the body. However, the mechanism can be very similar, just it shows up in different areas due to the fact that your family history is a little different, or your life history is a little different, whatever it might be. So this particular paper doesn't specifically cite Hashimoto's, but I think it would be prudent for us to say, well, if we can have a positive impact on those other areas, then we know that there is an increased likelihood that probiotics can be beneficial for Hashimoto's. And so you see on the last line there, these studies conclude that there should be a critical discussion of the existing data on the use of probiotics in these autoimmune diseases. And in the discussion within the paper, they determined that the reason for that discussion is because the outcomes of it are very positive.